Hello everyone. Welcome to our channel Krityan Academy, #1 Medical Coding Institute. We do provide online and offline live classes. Today we are going to discuss about surgery coding. The topic is CABG. The topic is about CABG. Here you can see coronary artery bypass grafting. Coronary artery bypass grafting CABG procedure. And we have a CPT codes from 335102 to 33548. So these are the CPT codes for CABG procedures. And here you can see the image coronary artery bypass surgery. Here you can see this is a before surgery. So here the artery is got blocked due to the plaque. And after surgery, here you can see that artery has bypassed. So exactly this is what we are going to see now, how they are going to perform this surgery and what are the steps to follow to code correct CPT code, to code correct CPT code. What is coronary artery bypass grafting? Coronary artery bypass grafting, this is also known as CABG. It is a surgical procedure that restores blood flow to the heart muscle. And it will restore blood flow to the heart muscle by creating bypass around blocked coronary arteries. Around blocked coronary arteries using vessels from other body parts. Using vessels from other body parts. It is mainly, primarily like used to treat a coronary artery disease patients, and which is called CAD, coronary artery disease patients, CAD patients. If you see here, this is a healthy artery. The blood is flowing normally without any obstructions, But if you see here, this is a blocked artery due to some plaque or yellow fat. Got it? So if it becomes here, no, that definitely the total it will block only. So this is the blocked artery. This is a healthy artery. Just for your understanding, the difference between healthy artery and blocked artery. What they will do if it is a artery has got blocked. Here you can see. This is another image. This is the bypass graft only. So this is before surgery. Before surgery, there was a blockage. Here it is a blockage. Then what they perform here, they bypassed from here to the healthy one. So now the blood is flowing this way to here. This is nothing but coronary artery bypass grafting. From here to here, they will do the procedure. Wherever it is blocked arteries or veins in cardiac surgeries, so they will do the bypass surgery, coronary artery bypass surgery only. Here you can see they can take the arteries or veins from any other part of the body, and here you can see there is a source leg vein. This is a saphenous vein. And if they want taken any arteries, you can see here, this is an example, internal mammary artery graft. So from there, they will take and they will do the grafting. Here you can see the blockage in yellow color. This one is a blockage, and they perform the procedure. Saphenous vein graft from here to here they performed. So this is called bypass grafting. And here you can see another scenario. This is a blockage, and they have bypassed it from here to here only. Okay, so wherever it is a blockage, they will bypass it. They will bypass it. So this is what exactly in the previous slide I showed you, right? This is a plaque queue. If the plaque queue increases, definitely there is a clotting of a blood only. Not clotting of a blood, of course, it will stop the blood flow, right? So to avoid that only, they will do the procedure, which is bypass surgery. Bypass surgery. This is an overview only, like what exactly the CABG and how they will perform the CABG procedure. Let's see steps to coding CABG procedure. Steps to coding CABG procedure. So first thing we need to identify, is it arterial graft, which is only artery, or is it venous graft? That means only venous. If the surgeon only uses artery, like usually from memory artery, we can use the codes, and here you can see 33533, that is for one arterial graft. 33534 is two arterial grafts. 33535 is three arterial grafts, and 33536 is four or more arterial grafts. These are the grafts codes. And if the surgeon is using only veins, here you can see, if the surgeon only uses veins, usually that will be taken from Cephalus vein only. Okay, so these are the codes 33510 and 511. That's two venous grafts. So based on the grafts, how many they are doing. If they are doing four venous grafts, use this code. If they are doing more than six grafts, then you can use 33516. But make sure that whether they are doing artery or venous, or we have a combination of both also. And here you can see an example. This is an artery and the blue color is a vein only. Usually the artery carries oxygenated blood away from the heart only, whereas veins carry blood back to the heart. Okay, so these are the arteries and veins. Coding is based on, you need to check whether it is arterial or venous. This is a combination only. If they are performing both artery and venous combination, we should report two codes only. Here you can see, when both types, what are the types? Arterial and venous only. So if they are using both the types, must report two codes. First, select the primary code for arterial graft from here. How many arteries? Check that and use this, any one of this code only. And second thing, add on code for the venous graft from here. 33517 is for one venous graft, 518 is for two venous grafts. So based on the number of venous grafts, you can choose this as an add-on code. If it is a combination of both arterial and venous grafting, use first artery code followed by the venous code only. And also we need to check if they are doing any harvesting only. So there are add-on codes which you can see here, 33550. This is for harvesting of cephanosvine, and many payers bundle this, but check it payer specifications and use this 35500. Okay, this is a harvesting of cephanosvine. Also upper extremity artery, this is harvesting of artery, radial artery, and 35600. These are all add-on codes. Along with CABG, we need to code this if they are performing any harvesting. 33508 is a endoscopic harvesting, and if the surgeon uses a scope to take the vein from the leg. If the surgeon uses a scope to take the vein from the leg, that's what EVH and endoscopic harvesting. Okay, harvesting also, please check it. Then was it redo procedure? That means if the patient has had a CABG or heart surgery before, we have an add-on code for that, 33530 only. Add this code if it has been more than 1 month since the previous major heart surgery. That is called redo procedure. That is called redo procedure. You need to use 33530. Then we have a cardiopulmonary bypass, and that's a machine you can see here. While doing the CABG procedure, they will take all this to outside the machine only. So this machine we don't code separately. This is bundled. So CABG codes include the use of the heart-lung machine. This is what heart-lung machine, that's called cardiopulmonary. So we don't need a separate code for cardiopulmonary bypass only. Got it? So check this, whether it is arterial graft or venous graft or combination of arterial and venous, and check harvesting, and then check was it a redo procedure. Just remember all these steps. And let's see some scenarios here. A surgeon performs a three-vessel CABG using the left internal mammary artery to the left anterior descending artery, and two saphenous vein graft harvested endoscopically. Okay. So if you see the code 33533, this is for single arterial graft. So where is that? Here you can see left internal mammary artery, right? So for one artery, we are coding 33533. And next one here, they are doing two saphenous vein grafting, right? Two venous grafts, we have a code, right? 33518. And also they are doing vein harvesting. So endoscopic vein harvesting, we have a code 33508. And for this scenario, these are the three CPT codes we will give. See, I'm checking here whether it is arterial or venous or arterial and venous. This is an arterial and venous only, which is a combination. Artery they did and venous also they did. So first artery, you code it. How many arteries? Single artery, right? 33533. And two venous grafts, 33518. And endoscopic harvesting, we have an add-on code 33508 only. The next, if a surgeon bypasses two vessels using the left internal mammary artery and right internal mammary artery. This is a two arterial grafts, only artery graft they did only. So we have to code only arterial grafts. So there are two arterial grafts, which is 33534. The next one, a surgeon performs a triple bypass only, CABG. They did three artery grafts. Okay, here, and using the saphenous vein grafts harvested open. So here you can see three venous grafts, 33512 only. So usually the saphenous vein grafts harvested, right? So this would be included and this would be bundled into the CABG procedure. If it is endoscopically, means we need to code separately. So here only they perform the CABG 3 arterial. So we have a 33512. And we have a patient who had, sorry, venous grafts, this one, 33512. And a patient who had a previous CABG 2 years ago undergoes a new single vessel bypass using an artery. So here you can see single arterial graft, which is 33533. And of course, this is a reoperation, right? We need to give a 33530 for reoperation. That's what a redo procedure is there now. For that, we need to give a 33530. So these are all the few scenarios. If you want more scenarios or more case studies, please reach out to the below phone number, WhatsApp the details. So we will share you more details. Thank you for watching. Please stay tuned for more coding knowledge. Kindly share and subscribe our channel. We guarantee 100% we provide the knowledge. Thank you all.